TopMedTalk. Hi, welcome back. It's Monty Mythen here, Editor-in-Chief of TopMedTalk, coming to you live from the ANZCA ASM. That's the Australia New Zealand College of Anaesthetists and Faculty of Pain Medicine annual scientific meeting here in Sydney, Australia. So TopMedTalk are here as guests of ANZCA and supported by an unconditional grant from 3M. We're just right next to their stand in the trade exhibition. That's stand number 79. Doing a series of podcasts here, and we're just about to take on environmental sustainability. So I'm joined by our guest, Dr. Jess Davies. Jess, welcome.
Hi, Monty. Thank you so much for having me. I am an anaesthetist at Austin Health in Melbourne, and I do lots of environmental sustainability things, including I was a co-founder of a group called TRASH, which stands for Trainee-Led Research and Audit in Anaesthesia for Sustainable Healthcare, which is a bit of a mouthful, but a great acronym. And we've done a number of projects, including Operation Cleanup across multiple hospitals in Australia and New Zealand and the UK, and a couple of collaborative trainee-led audits as well, one of which was just presented in the session prior by Daniel Brooks-Reed. And I'm also undertaking a PhD in translating the evidence for environmental sustainability into practice.
Excellent. So when it comes to translating into practice, there's been quite a lot of chatter about the choice of anaesthetic agents, for example. Whereas, every time I've been in the operating room, I retired from that relatively recently, the thing that appeared most shocking to me was the pile of waste that we left behind, of plastic and wrapping and disposable things and throwing things away that look perfectly reusable. What are they all in play? Is there one factor that's bigger than another? Or is it more important as to how far we travel to work? What are the big things we can make a difference to?
Yeah, there is a huge number of things that we could do. And healthcare, compared to other industries, is way behind, really, compared to the construction industry that has lots of environmental assessments. We just don't have that. But the ones that we do have are quite impactful. And certainly choosing an anaesthetic agent that is less harmful environmentally than others is important. And the two main ones to avoid would be desflurane and nitrous oxide. But equally, the stuff that we use and the things that we're actually touching and throwing out is also hugely important. We know that around 2/3 of our entire healthcare carbon footprint comes from our supply chain, and that includes our pharmaceuticals that we discard without use. It includes all of the plastic equipment that we use. And so one of the topics that I'm really interested in is how do we know that reusable equipment is safe and good to have, but how do we go from such a disposable world and introduce reusable equipment which prevents lots of waste, and it also has a lower carbon footprint.
So we've seen, in my lifetime as an anaesthetist, I've seen the journey from reusable red rubber tubes that we would wash under a tap and try and do our best to disinfect and then hang out to dry, all the way through to the idea that we should throw away what looks like a perfectly reusable laryngoscope, a piece of metal that looks as though it's got a good few years in it, and yet we seem to throw it in the trash can. I don't know exactly where it goes next, but how do we reverse that? Because some people say that's just too hard to reverse, and I think, well, come on, we can do better.
Yeah, a really difficult problem, but I think we have some really amazing examples around the world, really, about how people have managed to go from a very disposable world back to a reusable world. I'm not suggesting that we should be washing our red tubes again, but there's certainly some steps where we can find a happy medium, and particularly having single-use metals is just so wasteful. That metal has been mined, it's a finite resource, and it's going to be in landfill or incinerated. And the process really has to be multidisciplinary. It's partly our decision about what sort of equipment we use, but we need to do it in a way that's sustainable over time, which must include infection control and patient safety, of course, at the top.
So if we stick with the example of the disposable Macintosh-bladed metal laryngoscope, for example, so for a very, very long time they were reusable. The blades would be taken off and they would go for some form of probably steam sterilisation and come back and get reused, and everything seemed to be fine. We seem to switch to disposable based on a myth rather than evidence. I'm not clear where the evidence was that they were risking infection. It's quite hard to reverse trends that are based on myths rather than evidence, because it's hard to produce evidence to counter a myth.
Yes, I know exactly what you mean. I don't have a good answer for that, except that we now have an ability to make decisions not just based on finances or a patient's factor issue, but we can take a triple bottom line approach, which is commonplace in other industries outside of healthcare, which also includes an environmental perspective, and that evidence base is definitely building. And so we then have usually at least two of the three to say reusable equipment is cheaper over time. It often performs better, particularly laryngoscope blades compared to the plastic disposable laryngoscope blades for some of the video laryngoscopes. And that environmentally, reusing equipment, even with washing and using a steam sterilizer, it is still environmentally better than a disposable item.
And is there any examples anywhere that you've seen where people are starting to see legislation to turn around and say, as opposed to making me throw it away, they're going to make me not throw it away?
That's a great question. I don't know about legislation that goes that far, but certainly medical products are highly regulated, as we know, and we are bound by accreditation standards that, set the standards for infection control and preventing cross-contamination. So there's a bit of movement now, at least in Australia, to address some of those accreditation standards and say, well, actually, is that taking an environmental perspective as well?
You talked about the supply chain, for example. I mean, when I'm having one of my typically boring moments, I reflect on the fact that we used to, in the United Kingdom, one manufacturer made endotracheal tubes in Hythe in Kent, and they would get loaded onto trains at night and distributed around the country, and they cost about £1. This is in relatively recent history. Perfectly good plastic recyclable tubes, and then to save a penny, they were made in Mexico. What about that? What about making things closer to home?
Yeah, I think, there is a lot of social benefits to doing that. And also we're starting to get some information about the social impacts of some of the products that we use. And that may be some really difficult discoveries for healthcare, which, our industry is built on doing no harm and doing good for the world, really. But if our supply chain is, not ethical, using unethical labour, poorly paid staff, is that really the best supply chain choice for us? And what's interesting is that, as environmental sustainability becomes a, more commonly talked about topic, then we're starting to have conversations that extend not beyond environment, but also to social and governance part of the ESG frameworks.
So what can we who are enthusiastic to do our best next week? What's our top 3 things we could do next week? We've mentioned one of them, I think, already, which was the choice of anaesthetic agent.
Yeah, you can definitely make a choice of anaesthetic that is less environmentally harmful, and that includes using low flows if you're using a volatile agent, and avoiding desflurane, obviously. Secondly, you can be involved, because the wider public feels very strongly about climate change, as we've seen through elections and public opinion. And that is also reflected in our healthcare community. And so being involved in decision making and engaging with other decision makers like infection control and our nursing staff, who are often involved in procurement, can start to influence our operating theatres and how they look and the kinds of equipment that we see. Because although it may be a challenge, there is certainly small steps to be taken that leads to greater momentum.
So what are the biggest wins that you've had in recent years?
My group, Trash, has a Ditch the Des campaign, and we invite hospitals to participate voluntarily in at least pledging to remove desflurane or reduce desflurane. And then we also have a published list of hospitals that have removed desflurane from formulary. And that has a significant environmental impact, a financial benefit, and has very little impact on patient care. And I think that's a great achievement, and something that continues to grow. And I think the thing that I'm most proud of is we actually created a community of interested people and provided trainees opportunities to take on a quality improvement project or dabble in research in a topic of environmental sustainability, which has inspired them and generated some momentum in the field, which I think is really exciting.
Can you share with us any exemplary examples of countries or places or organisations? You may not be able to name them, but what's the best of the best look like at the moment?
The NHS, greening the NHS is absolutely the benchmark, because they have a national team, they have clear goals, and they have demonstrated huge change with financial benefits, and we have huge amounts to learn from them. And one example is that Scotland has removed desflurane completely from use as of the last couple of weeks. And, that sort of change comes about because people are engaged, there's leadership, and people understand what the goals are.
Excellent. So let's go ahead, say, 5-10 years' time. How dramatically different do you think it's going to be?
I think our patient care will continue to be of an excellent standard. But the ways that we are delivering anaesthesia may change slightly in terms of the equipment that we're using and the sorts of processes that we value in theatre, and that includes reusing equipment, avoiding harmful volatile agents like desflurane, but also addressing some of the low-value care that we can eliminate out of healthcare. In Australia, we know that of the entire carbon footprint of healthcare in Australia, 80% is related to clinical care, and of that, 60% is high-value care. But there's also low-value care and also harmful care, and avoiding that in the first place is good for patients, but also has an environmental benefit because you avoid an unnecessary admission or avoid unnecessary surgery, and that ultimately has the greatest environmental impact.
And by that, I'm guessing you're talking about a particular type of procedure that didn't ultimately produce patient benefit and perhaps wasn't the right thing to do in the first place.
Indeed.
Good stuff. Any other top tips for me in the rest of my life?
I think being curious and interested in what's happening in your world, exploring why we have this particular piece of equipment, why are we doing this like this, what sort of things can we improve, is all part of it.
Now, in one of the big transitions possibly for the better during COVID is we seem to stop a lot of unnecessary outpatient visits, which are quite disruptive to people's lives, taking days off work, and they've been replaced by telephone calls or Zoom or Teams calls, and it appears as though that's stuck. I'm guessing that's quite an environmental benefit as well.
Absolutely. If we can avoid patients coming to hospital, they avoid potentially contracting an infection, they avoid transport and the emissions associated with that, and patients love it. So I can't see that that's going to go anywhere, but certainly understanding that all of those processes can also be viewed through an environmental lens, not just about recycling plastics or things.
Okay, my last most difficult question probably is, here we are at a meeting called Be Connect, and there are people here from all over the world. So I'm here from London, England via Southern California, and we feel as though it's important for us to get together and to share information and connect with people, but that's a massive carbon footprint. Should we stop it?
I think this question gets asked of me every time I attend a conference.
Well, we're all here talking about the fact that we should do less of this. So it is really difficult. It's a fair question, isn't it?
But we have to be pragmatic and reasonable about the sorts of things that we ask or expect people to do. And some things are really valuable, like attending a highly valuable and informative meeting and connecting with people. Those things are undisputably valuable. But there are things that we can tweak about it. Your emissions flying in business class over a long haul flight are far, far, far greater than flying economy in a domestic flight.
Right.
And flying frequently obviously has a much higher carbon footprint than
flying infrequently.
than flying infrequently. And likewise, we don't have the benefit of taking non-aviation travel much in Australia because of our enormous land size. But where those opportunities exist, then, you can reduce your carbon footprint but still participate.
Great stuff. Well, I'm sorry I have to cut this short because we've both got other responsibilities to go to in a moment in the meeting. So thank you very much indeed, Jess, for sharing with us. Thank you very much indeed again to ANZCA and our sponsors, 3M for this particular booth, but also our other major sponsors, GE Healthcare, Edwards Life Sciences and Medtronic. Without you and our other sponsors' generous gifts, we won't be able to continue to produce this as free open access medical education. I'm sure you all know there are thousands of podcasts available now on TopMedTalk, and we're just about to tip over our 2 million downloads in over 100 countries around the world. So thank you very much for listening, and thank you very much again to our sponsors. We'll be back tomorrow morning. We're talking about disability and patient-centred outcomes. And following that, we'll be talking about welfare and advocacy. So I look forward to seeing you all tomorrow. Take care.
TopMedTalk. Thanks for downloading TopMedTalk. Don't forget to subscribe via your podcatcher. Don't forget to check us out on social media. We're on Twitter, Facebook, LinkedIn, and YouTube. And also, don't forget, TopMedTalk is the broadcasting arm of EBPOM, Evidence-Based Perioperative Medicine. We'd love you to find out more about that. If you check out ebpom.org, you can find low prices on some of the conferences we're organising around the world. Many of them are virtual and don't even involve you leaving your own home. Check out ebpom.org now.